I would like to begin my presentation today by acknowledging the Aboriginal and Torres Strait Islander peoples as the traditional custodians of country, recognising their continuing connection to land, sea, culture and community. I acknowledge the Wurundjeri Woi-wurrung people of the Kulin Nation as the traditional owners of the land on which I reside. I pay my respects to elders past, present and emerging. My name is Monique Davey, and I'm here today to present information on creating a mental health recovery plan for someone from a migrant background who is suffering from anxiety disorders. By using a case study as an example, I would like to walk you through the thought process that goes into creating the individualised and personalised health plan. The objectives of this presentation are to understand what anxiety is and how it may present, to assist in understanding the prevalence of anxiety as a mental health disorder in Australia, to know what assistance, support and prevention is available, to understand the process behind a personalised plan when an individual presents from a culturally and linguistically diverse background, and to share my own learning experience, critically reflecting on this learning and how I will apply it with my clients. Affecting 17% of the Australian population, anxiety disorders include generalised anxiety, social phobias, panic disorders, and obsessive-compulsive disorders. For an individual suffering from an anxiety disorder, the day-to-day activity is disrupted with thoughts and behaviours affecting the well-being of an individual. Let's have a quick look at some of the more debilitating behaviours and traits under this umbrella of anxiety. OCD, or obsessive compulsive disorder, affects around 2% of Victorians who suffer debilitating impairments. They're often housebound, fearful of contamination, and complete ritualistic behaviours to avoid a sense of imminent doom. SAD, or social anxiety disorder, is generally based on the number of fears someone has. The more fears, the worse the disorder. The person has persistent fear of social situations where they may be humiliated or embarrassed. Given the chance, this person will avoid those situations. Panic disorder is when recurrent and unexpected panic attacks occur, with an abrupt, intense fear which may include heart palpitations, sweating, trembling, shortness of breath, nausea, chest pain, or feeling faint. In the brain, the amygdala and brainstem are the response mechanisms to perceived threats. This is an adaptive defense survival mechanism. Much like a mouse might appear anxious if they have seen a cat, they are alert, their heart is racing, they're ready to run with the fight-flight part of the brain response. In humans, this adaptiveness to the surrounding environment can become dysfunctional. The person can ruminate on all the possible outcomes of a threat situation, and this takes over, leading to an anxiety disorder. Anxiety is prevalent in females more so than males and can occur at any time in someone's life. One of the risk factors for anxiety is growing up with a parent who also has anxiety, indicating that this can also be a learnt behaviour. Bullying, family domestic violence, loss, adverse experiences, isolation, and adverse childhood experiences are all risk factors that can escalate anxiety to a point where it becomes a disorder. Anxiety is the most prevalent mental health disorder. In 2018, anxiety in Victoria contributed to almost 46,000 disability-adjusted life years, or DALYs, where one DALY corresponds to the loss of 1 year of full health. An amount of $12.2 billion was spent in the 21-22 financial year, equating to a spending of $472 per capita or per person. Whilst anxiety is the lowest funded mental health disorder in Australia, there are still many services available for people to gain access. Online services have improved since 2020 when COVID forced repeated lockdowns, especially in Victoria, paving the way for accessibility. This meant that remote and rural communities could also gain access through digital mental health services. Given the fear-based complexity of this disorder, online support such as chat groups and helplines have allowed greater access for this community. Some of these services include Beyond Blue and ArcVic. Phone apps have also become popular, such as Calm Guide and Headspace. Whilst popular, these apps offer little depth in testing and often do not involve healthcare professionals. Specialist anxiety counsellors, mental health nurses, social workers and occupational therapists, Aboriginal and Torres Strait Islander health workers, psychologists and psychiatrists all provide services for anxiety. However, the starting point is usually a GP who will do an initial assessment and create referrals. Victoria has several initiatives in way of promoting and for prevention of mental health disorders such as anxiety. They promote early intervention for GPs to diagnose anxiety disorders early so that they can prevent or reduce the progressive anxiety to other mental health disorders. Preventative programs in schools where teachers are funded to understand and provide safety environments for mental health, and there are parent programs targeting positive parenting, regional parenting, and parenting for gender diverse children. Pharmacological treatments are based mainly around increasing serotonin levels in the brain to emotionally stabilise and calm the individual. These can be fast-acting or long-term. The most effective non-pharmacological treatment for all subsets of anxiety disorders is CBT, or cognitive behavioural therapy. The therapist focuses on reconstructing cognitive patterns associated with anxiety. It is the most studied and validated form of therapy for anxiety. Let's look at a case study where someone has presented with an anxiety disorder. As we learn about Anna, we can see how pieces of information can be worked into a mental health plan. Anna immigrated to the USA from India to study business and economics 7 years ago. 5 months ago, she moved to Melbourne after accepting a job at an international firm. Anna describes herself as ambitious and a perfectionist. In America, Anna saw a GP because she was not sleeping well. She was suffering fatigue, was nail-biting, had constant busyness, and would procrastinate. The GP suggested she had high-functioning anxiety and prescribed temazepam and told her not to worry so much. Anna had a good circle of friends of similar cultural background that she left behind in America. She is not close with her parents, who are still disappointed that she did not become a doctor. Since arriving in Australia, Anna has made some work connections that she would like to turn into friendships, but she feels she doesn't fit in culturally at her work. She has visited a local Sikh temple where she enjoyed a meal and was able to meditate. Whilst she was there, she met a few nice people of similar age. Anna has begun to have panic attacks both at work and at home and feels that she has no one to lean on for support. She doesn't want to share her issues with her family or friends for fear of seeming like a failure. Anna has decided to ask for help now, as her boss has asked her to start running presentations. She's happy about the recognition, but at the same time, she's worried she's going to have a panic attack whilst presenting and will be labelled incompetent. Anna's goal is not to have panic attacks and to establish friendships, particularly with people of similar cultures. To work with Anna, she may wish to discuss taking beta blockers and their side effects with her GP as fast-acting short-term medications for her presentations. Her GP can also do an initial K10 assessment and provide referrals to more specialised therapists. CBT therapy would be appropriate for Anna to change her thoughts and behaviours when feeling anxious. Having a culturally sensitive therapist would also enable Anna to understand the benefit of creating new friendships at work and will give Anna tools to discuss her disorder with friends in the US and her family should she choose to. By attending the temple regularly, Anna can also build friendships with her peers. Anna is familiar with meditation, so by using a phone app, she could build this into a daily routine. And having a healthy diet and regular exercise will be beneficial for her mental health. Connecting to online services such as ArcVic means she can also tap into discussion groups and attend group meetings for anxiety support. Measuring outcomes would include reduced or ceasing the panic attacks, less or no nail biting, better sleep patterns, less busyness, and friendships that are now established both at work and through the temple. Anna's care plan needs to show not just the biopsychosocial information, but also include culture and beliefs to give Anna the support she needs. Creating the plan with Anna gives her autonomy over the framework, goal setting, and progress. Anna is more likely to check in with the care plan team, allowing any tweaks or changes to be made along the way. Giving Anna access to support groups will normalise the condition of the anxiety, allowing Anna to understand that this is part of a continuum of mental health and does not define her as a person. A culturally sensitive therapist will give her the tools to be able to discuss her disorder with her family and friends. I am grateful for this course to better understand the larger picture of mental health in our society. Being sensitive to the biopsychosocial aspects and now including that respect of culture, beliefs, choices, and preferences allows me to better understand the client and to provide a more targeted and effective care plan. Additionally, understanding the services and deficits in service provisions for minority and marginalised populations, such as Aboriginal and Torres Strait Islander peoples, means ensuring that plans are accessible to clients and not just tokenistic. Tapping into culturally sensitive providers and those with lived experience is, I think, crucial to empowering the client to oversee their own mental health moving forward. Up until I did this course, I felt that I was leaning more on the biopsychosocial aspect of an individual, but now I can see that using this breadth of understanding, I can be more targeted and more effective. Thank you for your time.